In vitro fertilization, known as IVF, is a treatment to help you get pregnant. In IVF cycles, we produce the eggs, we collect the eggs, we fertilize the eggs with sperm, and then we transfer the embryos into the uterus. This is the best chance for you to get pregnant. IVF treatment has 4 major steps. The first step is ovarian stimulation. We just produce many eggs. The second step is egg collection. We just take the eggs outside of your body. The third step is the fertilization with sperm. And after we produce the embryos, the last step is the embryo transfer. At a standard IVF cycle, which ends up with embryo transfer, the period is like 20 days. In some couples, we just separate the treatment in 2 steps. In the first step, we just collect the eggs, we just produce the embryos, but we freeze the embryos. This is called total freezing cycles. If a couple is undergoing a total freeze cycle, the embryo transfer will be performed like 1 month later. In such couples, the treatment from the start lasts like 6 to 8 weeks. If you're under 35 years of age and if you're having unprotected sex like for more than 1 year, and if you cannot conceive, then IVF is a good treatment for you. In women over 35 years of age, this time limit for this unprotected sex is like 6 months. If you're having troubles getting pregnant after insemination cycles, intrauterine insemination cycles, then the best choice afterwards is also an IVF treatment. There are many other indications for IVF treatment, but the main discriminating factor for IVF success is the age of the woman. If your own eggs is to be used, then the age limit is like 42 to 45 years of age. With your own eggs over 45 years of age, it's not a successful treatment for you to get pregnant. When a couple just admits us with fertility issues, we just start with fertility testing. For women, we do the gynecological ultrasound and ovarian reserve test. We need to check the endometrial lining, where we transfer the embryos. For men, we start with the semen analysis test. Afterwards, we just prepare an individualized couple-based treatment for the patient, and then we can start the treatment. But before starting the treatment, if you're overweight or obese, it's better you lose some weight. You can start taking some prenatal vitamins. If you're drinking alcohol or smoking, you should stop smoking and you should stop taking alcohol before starting the treatment in order to have better success rates. Women's age is the most discriminating factor for IVF success. In women lower than 35 years of age, we have the best success rates. At first egg pickup, for a woman under 35 years of age, the success rate is like 55%. If the woman gets older, the success rate drops in every age group. For women with blocked tubes, IVF is the only way to get pregnant. In men with a low number of sperm cells in the ejaculate, like less than 5 million per milliliter, the only chance to get pregnancy is the IVF treatment. Some men does not have any sperm cells in the ejaculate. For these men, the IVF treatment with sperm retrieval is a chance for pregnancy. There are many other conditions where IVF can offer you a healthy pregnancy. Depending on the IVF protocol, the periods might change, but with standard IVF cycle with short protocol, it usually is 1 month to finish the cycle, and after embryo transfer in like 10 to 12 days, you can learn if you're pregnant or not. In freezing cycles, with total freezing cycles, and embryo transfer is performed after 1 month, the total period to get pregnant is like 2 months. In normal regular menstrual periods, 1 egg is released from the body, but in IVF cycles, in order to have more embryos, we need more eggs. To have the highest success rates, a woman needs to have 10 to 20 eggs per IVF cycle to achieve the best success rates. The only reliable tests for IVF success is pregnancy test, which has to be done after 10 to 12 days of embryo transfer. The blood test, HCG test, will surely show you if you're pregnant or not. You can do also an urine test at that time, but urine test can be misleading. So a blood test and HCG test will be the best choice for you to know if you're pregnant or not. IVF treatment can be physically and mentally tiring for you. For 1 year, up to 3 cycles is acceptable. If you cannot get pregnant in the first 3 cycles, it's not healthy to continue without changing anything. You need a re-evaluation, and some tests needs to be performed before starting a new cycle, and you can have a waiting period for the test results. Embryo development and embryo quality is one of the major determining factors for IVF success. If there are problems in embryo quality, if the embryo development is not good, then the embryos can be genetically abnormal. Embryos which are weak to continue developing or embryos which cannot implant is the factor for IVF failures. There can be different causes of IVF failure, but the major cause is the embryos and the embryo development related issues. If you're in menopause, if you're over 45 years of age, if you're not having any more regular periods, then you cannot have IVF treatment with your own eggs. But with donation, you can get pregnant. In women with uterine abnormalities, any disease related with the endometrial lining of the uterus, IVF treatment might be with very low success, or it might not be possible to get pregnant with IVF treatment. For men, if there is no sperm in the ejaculate, then we try to get the sperm from the testicles with a surgical retrieval method. In the surgery, if the urology doctors cannot find any sperm cells in the testicles, then we cannot go on with the IVF treatment also. When a woman gets pregnant with IVF treatment, the major factor for miscarriages is the woman's age. If the woman's age is over 35 years of age, the miscarriages are like 10 to 15%. But when the woman is older, the miscarriage rate can increase. In IVF treatments, in order to lower the rate of miscarriages, we can test the embryos at the laboratory, and we can just transfer you genetically normal embryos, which really decreases the rate of miscarriages and offers you a healthy pregnancy. If you have a negative result after your first IVF cycle, you can start a new one, and up to 3 cycles, your success rate is really high. But if you have failed almost 3 cycles, then you need to have some more tests to see what the cause is. If you have 3 failed cycles, changing the treatment modality might help you getting pregnant, or genetic testing or embryo genetics might also help you with a positive pregnancy test result. Or you can just seek for other treatment options.